Podcast de El Comercio de Colorado. Información que abre perspectivas.
Okay, Dr. Franz, we need to start talking to you. We talked to you almost 2 years ago when the only way for fighting the COVID was to go to the hospital before having the vaccine available. Now, at this moment, there are more than a vaccine. So let us know how the people in Colorado can fight against COVID in addition to be vaccinated.
It's a great question indeed. We start with vaccination. So be sure you are up to date with your vaccine and with your boosters so that it reduces your chances of being hospitalized. If you have a positive COVID test and have symptoms or not, the first thing that comes to your mind should be, should I get a treatment? The treatments are widely available and they are for free. And if you use a treatment, they can reduce your chance of being hospitalized by up to 90%. So just as we were encouraging vaccination to reduce hospitalizations, everyone who tests positive for COVID should think of treatments as reducing their chances of being hospitalized or having severe illness.
But these treatments are available at any place in any hospital, or how can the people have access to this treatment?
Well, I think for most, we have a doctor, a physician that we know, or a clinic that we use. And so when you test positive, you should reach out to your doctor or your nurse or clinic and ask them about whether treatments are right for you. However, for some, we don't maybe have a regular doctor. And so you can also speak to a pharmacist and a local pharmacist about treatments. In fact, there's a program called Test to Treat in Colorado that would allow you to get tested at a pharmacy and then get the treatment as well. And so if you went to the Colorado website, which is covid19.colorado.gov, you could learn about where these treatment sites are in the pharmacies. Then, of course, many visits today for health care are done like this with what we call telehealth. And there are many companies that offer telehealth visits to help you decide about treatments. Again, if you go to our website, we have 6 telehealth companies listed on the website. And you can, 5 of the 6 of them you'll find have Spanish language available as well. So you'll speak with a doctor or a nurse practitioner. They will determine if you have COVID and if you qualify for treatment, and then they will write you a prescription. And I've heard many stories of people getting a positive test quickly within a half an hour, doing a telehealth visit, getting their prescription, and starting their treatment within just a few hours of their positive test. And I think that's how we should all be thinking about this.
Dr. Franz, there is a lot of percentage, a big percentage of Hispanic kids that have been vaccinated. Now that they are on school, what we need to expect when the cases of COVID start increasing?
Well, as you know, over the summer in Colorado, there's been a COVID spread with what's called the Omicron BA.5 variant. It's the type of COVID virus in our community. And the cases went up in the first part of summer, and they've been going down more recently, mostly because a lot of people have been infected. And so over the next month and 2, I expect cases to still come down. So I think when the children go to our school, there may be a slight increase in cases, but for the most part, I don't expect any big outbreaks. So having our children vaccinated against COVID is the best way to protect them against catching COVID when they go back to school. And I think there will be less COVID in the schools for the first few months. It's possible that sometime in the fall or winter, there will be a new kind of COVID virus that will arrive in Colorado, and it may start spreading, but we haven't seen that yet. And so until we have more insight to that scenario, for now, we should expect the cases to be low. Thankfully, because people have been vaccinating their children, the adults, and because cases have been spreading already through the community.
Dr. Franz, do you have any message related with the polio outbreak in New York? Is there any cases in Colorado, or what is your message for the Hispanic families to be conscious about these risks?
Well, polio is a disease that we have not seen in North or South America for many years. This new case is very rare. It's in, I believe, in New York. We haven't seen any cases here in Colorado. Our children are vaccinated against polio in the first 2 years of life, and then they get a booster polio shot when they turn 5. I think for families of young kids, especially those who are now in kindergarten and first grade, it's very important just to be sure that your child has gotten their polio booster in the last couple of years. We want to be sure that every child is protected against polio. We'll be paying attention to see if it spreads in other parts of the United States, but we haven't seen that today. And we know that the vaccine is very, very successful. And so what's important for each family is to be sure their children are up to date with their polio vaccines, as well as the other vaccines that we give children at school.
Is there any additional information from the water surveillance system related with the increase of cases of monkeypox in Colorado?
Not at this point. You know, there's a small group of persons who are at risk in the state of Colorado, and we've been working hard to offer vaccinations. We have many doses of vaccinations now in the state, and are working hard to open up new clinics to make it more available to people in Colorado. But it's really a small proportion of adults who are gay, bisexual, men who have sex with men, who are the primary population at risk right now. And we're being sure that we're making it easy for them to access the vaccine.
But is there any case of monkeypox on kids in Colorado?
I don't think there has been. There was a case that we thought might have been a child here in Colorado, but then it turned out not to be the case. So not at this time.
Thank you, Dr. Franz.
Thank you so much.
Podcast de El Comercio de Colorado. Información que abre perspectivas.